Tennis elbow is a common condition. In fact, I think it's almost a rite of passage in life that at some point in one's life, you very probably will develop tennis elbow. Medically, that condition is called lateral epicondylitis. In fact, most patients that have lateral epicondylitis or tennis elbow never play tennis. Tennis elbow is a condition where one of the extensor tendons that pulls the wrist up will become degenerated and torn. Tennis elbow is interesting in that, again, it's called lateral epicondylitis. The itis at the end of that word implies that tennis elbow or lateral epicondylitis is an inflammatory condition. That was our previous thinking. Actually, our understanding of tennis elbow has evolved. Now we call tennis elbow a tendinopathy rather than a tendinitis. And the tendinopathy implies that the tendon is not necessarily inflamed, but it's perhaps degenerating. And if we look at that tissue under a microscope, what we see in fact is degenerated tissue with little micro tears in the tendon with perhaps a healing response. We traditionally have treated tennis elbow with cortisone injections. Our understanding, as I've just mentioned, of tennis elbow is that it's not so much an inflammatory problem, but interestingly, cortisone has helped many people through the years. And so even though our understanding of tennis elbow has evolved a bit, we haven't totally given up on a modality, i.e. steroid injections, which we have seen help many people. Before you ever come to the office, if you think you have tennis elbow, you might have pain over the lateral aspect of the elbow. It's traditionally worse with gripping activity. Commonly shaking hands with people and gripping firmly will reproduce that pain. Treatment options for tennis elbow at home include anti-inflammatory medicines, which in essence act as non-narcotic pain pills. Aleve and Advil are great places to start for that. Repetitive use of your arm will often exacerbate tennis elbow, and so to the extent that you can, we recommend that you perhaps cut back on strenuous activity. One of the easy things to do with tennis elbow is to retrain yourself about your lifting. If you haven't already discovered this, if you lift something with your hand palm down, it will absolutely kill your elbow because of that lateral pain. And if you will very simply turn your hand palm up as you lift, you'll discover, surprisingly, there won't be any pain at all in your elbow. And so if you're lifting, for example, a grocery bag, lifting palm down will really stress your elbow. Lifting palm up will make all the difference in the world. And so watch your lifting, avoid repetitive overuse to the extent that you can. We like ice on the elbow to treat tennis elbow. We actually also curiously treat tennis elbow sometimes with a wrist splint. Now it sounds odd, I know, that we would treat an elbow problem with a wrist splint, but remember, the problem is degeneration of the tendons that pull the wrist up. And so if you can support the wrist, relax the wrist, rest the wrist with a brace, then many times that will help resolve tennis elbow on its own. If you continue to be symptomatic from tennis elbow, come on in and see us at Franklin Orthopaedics. We've got some tricks up our sleeve that you don't have available at home. We have cortisone injections, physical therapy. One of the most promising things that we're doing for tennis elbow now is platelet-rich plasma injections, also called PRP. And we have success treating most people conservatively. For those rare patients that continue to be symptomatic from tennis elbow, we have the option of surgery. At the time of surgery, I would go in and remove the degenerated, torn portion of that tendon. It's an outpatient surgery. You would go home that same day, of course. Stitches would be in for about a week and a half. We would progress with physical therapy and use of your arm as tolerated. And while surgery is usually not a quick fix for tennis elbow, it's often very helpful, and it's something that at the end of the day, once you're healed, we ultimately have very good success with.